All right, Jess, what do you think? Should we go ahead and get things rolling?
Yeah, I think we're good.
All right. Well, once again, let me welcome you all to this really exciting virtual simulation. My name is Ann Berger. I am the Community Outreach Director at Allegiant Global Partners. I will also be your moderator throughout the course of today. And partner very closely with a number of folks that I will introduce to you in just a little bit. A couple of things to be thinking about. We are recording this session, so I will make this available to everyone at the conclusion. Certainly, any of the slides that you feel are relevant, we're happy to share with you. Keep in mind that most of you did receive or should have received the case study itself. But again, I'm happy to provide any additional information, or if you didn't receive that, certainly get that over to you. This is a session that is approved for SHRM recertification credits. So to ensure that we get that completed, I will be asking you all for some feedback, and I will be putting the survey link in the chat and encourage you all to be sure you take a look at that and give us the feedback, because that's super important to us. These things are for you, and we want to make sure we hit the mark. And likewise, I will be getting certificates of completion out to all of our participants, so you have that in hand as well going forward. The chat will be active today, so please feel free to use that. I will be posting questions in there. Again, I will be posting information as we go through, so that will be available. If you miss anything in the chat that you would like to keep or hang on to, please let me know, and I'm happy to email that to you directly. So some of the housekeeping items as they are, and I think at this point, why don't we push forward and do a brief discussion guide and then get things going. So I'm going to do introductions, as I just alluded to. We're going to then move into with my colleague, Jessica Hessler, taking us through considerations for developing a simulation exercise. Jessica will also be talking about the virtual simulation exercise itself. I will be placing you in group sessions and breakouts, and we will also do group debriefs and lessons learned. And then we will wrap up and hopefully put a bow around our learnings and send you off with some new tools for your tool chest as it relates to assistance, and evacuation. So those are two pretty important pieces. So with that, let's get started. I am thrilled, as is Jessica, our Director of Assistance Solutions at Allegiant Global Partners, thrilled to welcome our partners to this very important and timely topic. So with us from the Conterra Group, Raven Ellis, Director of Clinical Operations, and Tim Calvi, Senior Consulting Psychologist. With us from On-Call, Ryan DiStefano, Vice President, Global Assistance Services, and Gabby Hosea, RN, Director of Clinical Transport. And from United Healthcare Global, we have Pascaline Wolferman, Director of Healthcare Intelligence, Aaron Youngblood, Regional Vice President of Client Development, Amit Arwin Decker, Medical Director for North America, and George Barrett, Vice President of Client Development. And we could not be more pleased that they are with us and are going to provide you with some really wonderful subject matter expertise as we go through this call. So with that, I'm going to stop talking and I'm going to turn things over to Jessica to get us started.
Wonderful. Thank you so much, Anne. So what we wanted to do is just talk a little bit about really the considerations for developing a simulation exercise when you're doing this internally. Why do this? What is the point? What are you going to be getting out of this for yourself and your organization? And so if we highlight some specific goals and objectives and really the success of these types of initiatives, a lot of it is around internal alignment and cross-educating with the various stakeholders across the organization. And that is probably one of the most impactful outcomes of this type of process. Through the process, it's also very important to just identify those opportunities. You know, when you work through these simulation exercises, there's always opportunities when it comes to communication across the stakeholders, operational protocols, who's calling who, where does that initial call go to when there is a crisis overseas or really anywhere? You know, what happens? Are those plans in place? And then identifying duplicate coverage from really an insurance perspective. Will it cause confusion if something comes up and potentially there is duplicate coverage? Are there funds being spent on that duplicate coverage that really aren't necessary? So this process also highlights those aspects as well in terms of your internal protocols, procedures, and programs that are in place. Another piece of this is that from this perspective of, you know, long-term strategy, you know, making sure that you're focusing on this as not a one and done. This is a very effective and impactful process. If you are, you know, running this initiative and really your organizations, all those stakeholders that you are bringing in are looking at this from the perspective of how is this going to make us better as an organization? And what is the cadence to follow when it comes to this process? How are we going to continue along with this and make sure it's not just, oh, you know, once and completed, then you never return to those learning opportunities that you discovered along the way. When you want to, you know, consider how to make this the most effective process, and really when you're going through the actual simulation exercise itself, a big part of that is engagement. And how are you going to engage the participants? And you want to make sure that everything is, you know, from a logistical perspective, all the information prior to the simulation exercise event is communicated ahead of time to those relevant stakeholders. Make sure you're inviting relevant stakeholders when it comes to, you know, who would be involved in this type of simulation or real world or, you know, real life type of example. Who are the stakeholders that are most important to, you know, to the process and how this process or how this incident would be carried out. Making sure that you're scheduling this well in advance of the session, so giving people enough time to ensure that this will be on their calendars and they have enough time to plan for it. From a logistical perspective, it's also important to make sure that the stakeholders understand why it's relevant to them and to their role. That will also help when it comes to engagement. And then when it comes to technology, there are so many things you can do now when you think of Zoom and Teams and Microsoft and all these technology applications available to you. Make sure you understand, you know, all the different features available. Today we'll be using those breakout rooms, which helps to really ensure that you know, that there's poignant questions associated with, you know, how we're going to get those stakeholders speaking to each other. It allows for that report out process. And so participant or stakeholder doesn't have to just kind of listen in and not participate. Because obviously when you participate, you commit yourself to really the process and the outcome. And then of course, just keep it interesting. Going back to the idea of technology, you can always use technology to kind of pepper in some interesting or kind of things that may add a little bit of a flair while somebody is in the breakout room, adding a different piece of information, you know, just using all avenues of keeping it interesting and keeping people engaged. So there's a few things to think of when you're thinking of engagement. You know, it does happen before the session of making sure that you're sharing the information ahead of time, and you know, making sure that the stakeholders understand what the expectations are when they come to the session, that it's not just a listen type of an engagement, that you do want their actual participation. And provide any information that would be relevant or helpful prior to the session. So do you need to share the current insurance documentation ahead of time? Do you need to share the safety and security protocols that may be in place right now with your assistance company? what information is relevant in terms of the case study that you will be walking through in the simulation that they would find valuable ahead of time. In addition to that, understanding, them understanding what the long-term goals are. What is the ultimate goal of this process? And that will help to ensure that they have, they understand why that this process is so important. During the session, it will be important to develop the action plan associated with those gaps and opportunities that were identified in the session. So obviously, every organization has areas that they can improve. Following going through the simulation exercise, and during that session, kind of at the end of that session, outlining what are the action plans that are going to take place because of those gaps and opportunities that we identified, and identifying stakeholders within the group who have those action items assigned to them. That will absolutely help commit all of the participants to the process, and as they have an action item and a process or a plan associated with why they are involved. And then following the session, if you are, or a member of the organization really owns kind of the simulation exercise and really duty of care type of process, owning that cadence to follow. So what does that look like? What are the next steps? Are you going to be meeting in 2 months to talk about the results of those action plans and resetting where the overall safety security protocols, insurance plans are, resetting kind of the overall portfolio in the program? Who owns that? Who owns that process? If it's you, just making sure you're going ahead and booking that on everybody's calendar following the session. And no matter what, there's always improvements that you can make. Even if you have created such an awesome action plan, everybody's followed through, no matter what, if you do the same simulation exercise or a similar simulation exercise 6 months later, you're still going to find things to improve upon. So it'll also be important to conduct these simulation exercises at least twice a year to continue to improve your overall program. So with that, we are going to go ahead and start our simulation exercise. So how this will work is I will provide the exercise. I'll go ahead and talk through the case study. Everybody who signed up for this session, I think it was by yesterday evening, should have received the case study via email, and maybe even this morning. If anybody signed up earlier this morning, you should have received the case study by email. So feel free to follow along. If you didn't receive it, or if you haven't reviewed it yet, even if you did receive it, no worries. We're going to talk through all of it. We're going to have a part 1 and a part 2. So part 1 will take us through the background information and some details that you need to understand, and really the basis of the information, kind of the beginning of the simulation exercise. From there, we are going to break everybody out into breakout rooms to answer one question associated with the simulation exercise. You will have 10 minutes to answer that question in with your group. You will have a subject matter expert in that group with you. And then Anne is going to then take us all back into the main group together, and you will go ahead and provide a report out. Your group will provide a report out of that, the answer to that question. And we'll do that again for part 2 of the simulation exercise, and then we'll go ahead and debrief. So let's go ahead and get started. And Anne, are you following the chat just to, yes, you are, you're there. Okay, great. All right, so for some background information, your organization, Teach and Prosper, offers the opportunity for teachers from the United States to spend a year teaching studies to children in Nigeria. You have founded the organization 10 years ago, and it has proven to be incredibly successful, as the number of participants are growing by 20% every year. So this has been a very successful program. Your role is to oversee operations and finances. You really do oversee the day-to-day. It's a small organization, but you do have a team of 2 people. And those 2 people support you with initiatives like marketing and program administration, but really the bulk of the work falls on you. The majority of the individuals who participate in the Teach and Prosper program are young adults who have just finished their college degree and have an interest in traveling and donating their time in a meaningful way. So in terms of the insurance policies, all insurance policies and safety and security protocols do fall under your remit. And the insurance policies you have in place really do focus in on providing coverage for participants when they're abroad with Teach and Prosper. The participants are required to maintain their own domestic health insurance, even when they are abroad, in case they need to return home early. So these insurance policies that you have in place today include a foreign liability policy as well as travel insurance. So accident and sickness, medical and security evacuation, repatriation, and AD&D. Your insurance carrier does include a very robust assistance team to support creating operational protocols and ensuring there's a plan in place if an incident did occur abroad. And so you understand what to do if an incident was to occur. You know that you would simply reach out to the insurance company and the assistance team would be activated. Obviously, there's other things that go along with that. It's not, you have to become very involved from a communications perspective with your participants and with the school, but from an actual assistance point of service situation, you would call the insurance company and they would activate the assistance service team. Okay, so in terms of the initial situation, you have 14 teachers who have just arrived in country a few weeks ago. They spent the initial days in self-isolation due to the local country requirements. And then they spent a few days just getting to know each other, getting to know their surroundings, and really just kind of developing a basis for where they're going to spend their time. So it's 8:30 a.m. West African time, and it is the beginning of the second week of school. And one of the teachers, Emily, did not arrive to school in the morning to begin her class. So she informed her roommate the day before that she was not feeling well. So her roommate's name is Rebecca. And so since Rebecca knew this, she did go ahead and go back to check on Emily. When she went back to check on Emily, she answered the door. She had a fever. She was she had shortness of breath. The situation was just very concerning to both Emily and Rebecca, given that COVID-19 is still a major concern. So Rebecca encouraged Emily to see a doctor. Unfortunately, she could not wait until that appointment. That appointment wasn't scheduled until 1 o'clock. And really, Emily just started to really decline in terms of her symptoms. So what Emily did is she did decide to call an ambulance because ultimately that was just going to be the best way to get her care. So Rebecca's a little concerned though, because Rebecca has been living with Emily for 2 weeks. So there's definitely a concern of staying with Emily because of the fact that, there is a likelihood that this could be a COVID situation. So to take precautions, she did go ahead and put on a mask. However, it was a very concerning situation when it comes to COVID. So the ambulance did come. And Rebecca went ahead and let Emily go on the ambulance. She wasn't able to go because of COVID. And so Rebecca did go ahead and quarantine because of that concern as well. When Emily arrived at the emergency room, she did test for COVID and her results were positive. And so with Emily's consent, the doctor did call Rebecca to inform her of the positive tests. And then Rebecca is going to be kept updated along the way. So now we are going to go ahead and be broken up into our breakout rooms. You will either be assigned to question number 1, which is what actions do you take for Emily, Rebecca, and the remaining 12 teachers? Number 2, how do you handle your communication with the local school? Number 3, Who else should be notified of these positive COVID cases? And number 4, what insurance policies would be most applicable and relevant to the situation? So we will now let you go into your breakout rooms. Enjoy.
All right, folks, I'm about to push you into the rooms. I'm going to try and get all these questions into the chat, but those breakout room leaders, if you can just refresh everyone on the questions while I'm madly typing away so you can get started, that would be great. We will set some timers, we will pull you back in, and we will see you all shortly. If there's anyone that doesn't get put into a breakout room that wants to be, I should have caught everybody, but please chat and I will fix it as quickly as possible. So we will see you in a bit.
And we made it back.
I see you, Ryan. That's
Yeah,
great news. I didn't
the
lose
quantum
you in
leap
the
worked.
forever after. How did it go?
Good.
Good.
We're good.
Well, I see everyone is slowly getting pulled back into the large session. Very exciting. I didn't lose anyone in the forever after.
No, but that timer was serious. I mean, if you did not end your sentence, you're right back in here. So yeah.
You do not mess around with the breakout room timer. All right.
Awesome.
Well, welcome back, everyone. I am going to hand things right over to Jess, and we'll start to hear all the good work that y'all did.
Wonderful, wonderful. Thank you, Anne, and thank you for your awesome job with the breakout rooms. Okay, so let's go ahead and start our report out process. So for group number one, I believe your subject matter expert in your room probably did inform you that we are looking for one representative from each group to complete this report out, and you will have support from your subject matter expert as well. So for group number one, what actions do you take for Emily, Rebecca, and the remaining 12 teachers? Who will be to go ahead?
So I think we did fantastic job in group number one, with the exception of identifying the speaker for this.
Oh.
So there were so many ideas and things that we just went down and took notes. So maybe I'll go ahead and kind of do a summary of the group, what the group came with, and then team, please jump in and add some of the components. So we talked about, immediately everybody was wondering whether the other 12 teachers should be tested, whether we knew that PCR testing was available nearby, if we could provide that information. Then we looked at also understanding, is anyone already vaccinated, to understand kind of the risk behind that. With that information, we were wondering, well, do we have that information already available proactively, or is it something that we need to get once the situation happens? But also knowing that if they are vaccinated, are there some other medical situation that we need to be worried about? So we're thinking that maybe we should have some of the clinicians from the insurance company reach out and find out if anyone has any pre-existing condition that put them at higher risks for COVID, and then looking at what will, should there be a different process for this group that is at higher risk versus the group that may be vaccinated and might be a lower risk. We're also wondering about local regulations and making sure that we're following guidelines in terms of quarantine and all of that. We were wondering, should we pause the work or continue the work? So everybody's in quarantine, can they keep doing the work, or should we pause for a moment and settle the situation and see then what we could do later? Finding disclosure of medical information, I think we just talked about. Then we talked about all the psychosocial supports that we need to bring to the group. It seems that there's already some distress and anxiety, and we know it's going to be from the two, Rebecca, Emily, and the other teachers, as well as then potentially the family members. Everybody's going to get anxious, and so how we address that, how do we support them? We thought about maybe we should bring in telehealth, so that's because we don't know whether or looking at the providers locally, but maybe virtual health might be a better choice at that point before the need for on the ground. And then looking also in terms of the safety and security, identifying somebody as the point of contact for the family, discussions with the family, because we know we'll have a lot of information. We also thought that if we know that some people are at higher risk, maybe contacting the insurance company to make sure that maybe there's some plans happening, preemptive evacuation, consideration of these planning taking place in the background to make sure that if it's needed, there's a plan in place. So the rest of the team, please pitch in. Tim, I'm sure I missed some things.
I was actually just thinking that what a wonderful job you've just done. That was all the notes that I had written down on the list.
So you did take notes.
Yes, thank you so much.
Well, thank you, Pascaline. Thanks, Leslie. And I think what we're going to find, and that was very thorough, a wonderful job to Group 1. And I think what we're going to find as we work through all of these questions is how much all of these things highlight when you go through this process in terms of your own, procedures and these questions that come up when you don't think of these questions until you're in it. And so I think that, Pascaline, a lot of things that you just said, would you have thought of all those things if you didn't put yourself in this place? So thank you so much. And that was wonderful. Okay, let's go ahead and go to question number 2, group number 2. How do you handle your communication with the local school?
Yep.
Hi,
So
this.
yeah, we
Oh, go
nominated
ahead.
Diane to be our spokesperson, so she's going to give us a little summary.
So this is Diane Hanlon, and we thought that communication is really critical in this aspect, and having a communication plan before this situation occurs is absolutely important. One of the key points that we discussed was being transparent and getting your communication plan out as quickly as possible before something were to leak on social media or, to any other folks that could impact it negatively. And we also talked about the who, what, when, how method. So first you want to understand who is going to handle the communication. Would it be the folks on the ground in Nigeria? Would it be the organization from the United States? Do you notify everyone that's associated with the school or only the impacted individuals? And we discussed that some sort of notification should go to everybody that is impacted, just in case there are other people who might be having symptoms and need to understand what's going on. In terms of what, we thought it was critical to communicate what is the game plan. Emily and Rebecca, are they quarantining? Will we require the other teachers to quarantine as well? Would the school shut down for a certain amount of time or go to a virtual aspect? So communicating out what the actual game plan is. When a notification goes out, it could cause some, not panic, but some nervous feelings, and it was important for us to have the game plan so that everybody involved understood that there are actions being taken to kind of set a plan in place. The when component was as soon as possible and to be as transparent as possible, but also taking into consideration PHI and any information that you can't really address. And how was really important to us as well. So would you be communicating to everyone via phone? Would it be phone and an email? And you also want to take into consideration if it is in writing, could it get in the wrong hands and get into some publications, some news articles, negative press on social media? So really coming up with the who, the what, the when, and the how, and having that established before the trip occurs was really important for us. Anyone else in the group?
Well done.
Does anybody else want to add anything from group 2?
No, that was perfect, Diane. Thank you.
That was great, Diane. And I think one thing that you pointed out that was really interesting is, what is the other side of it. So as you mentioned, just making sure you are communicating, communicating effectively and timely, but looking at it in like a scrutinized way of, how could this get into the wrong hands, or how could this be miscommunicated in some way, and really looking at things from like the devil's advocate perspective and looking at it from as many angles as possible, but still doing it in a timely fashion. So that's a really big challenge. And I think what in terms of that methodology that you talked through, I think that is a very effective methodology and something that a lot of organizations could absolutely utilize in kind of a simple and effective way, the best way to go about it. So thank you so much. That was excellent. And group 3, your question was, who else should be notified of these positive COVID cases? Did anybody raise their hand to be a representative from group 3?
Yeah, sure. So this is John Akagi. We you know, to kind of piggyback on group 2 with the notification to the institution, obviously, we talked about kind of, you know, how that would look like. How do you, you know, making sure communication to those who maybe were in that close proximity of Emily and even Rebecca, and then also backing that up to maybe, you know, another type of communication to those that were to everyone in the institution, obviously. But then also, you know, I think it's very important, these being young adults, communicating to their family, making sure that they're if there's a emergency contact on file for them, you know, reaching out to those folks with giving them the appropriate information, probably much like the information you would be providing to others in the institution, ensuring that they have enough information, right? You don't want to just, you know, obviously communicate, hey, there's been an exposure and your significant other has been impacted, but, you know, give them resources and information. Also making sure that you're, you know, see what the process is for reaching out to the local authorities. You know, who needs to be notified from that standpoint? What are their protocols and procedures in place? Identifying, you know, what resources that you have, not only that you can provide to those impacted, but also what services, which I'm sure group 4 will get into this as well. But, you know, even looking at any availability of counseling services. Sometimes you can obtain that through your assistance company, because those that are, you know, impacted, not just from a physical standpoint or health standpoint, but the mental aspect of it as well. So, you know, reaching out to those different providers and things that you have, and seeing what's available. And I think a big part of it too, Matthew in our group brought up that it was important not just look from notification of those impacted, but reaching out and seeing what can be done physically, right? So he brought up a good point of, you know, we have for different situations, you need to make sure that whenever people do come back that were exposed, they're coming back to a clean and safe environment, right? So reaching out to those resources that can come in and make sure that that occurs as well. So that was our group. Did anyone else have anything to add?
No, John, that was great.
That was great, John. That was great. Really comprehensive, and not just thinking of in the moment, you know, who do we need to call right now? I think you all talked through a lot of things to consider, both in the moment, but also kind of more longer term or you know, just not just reactive. And I think you bring up a lot of interesting questions and points that make us all think, what if we do have a trip abroad and there is a case, and, you know, how do we prepare for that? Because, you know, right now it could happen. And so making sure that there is a plan in place, because this is one, you know, in terms of that notification piece, there's a lot of eyes on this. And so really making sure you're handling it appropriately is incredibly important. So thank you, John. That was excellent. Okay, so number 4, group 4, let's go ahead and look at your question. What insurance policies would be most applicable and relevant to this situation?
So Jessica, this is Paul. I was anointed with challenge and placed on the spotlight here to basically simple travel, the travel policy. Now, I want to wrap it up maybe with this terminology that or acronym that most of us should know by now. Proper prior planning prevents poor performance. Proper prior planning prevents poor performance. So knowing what our insurance policies cover and don't cover before we begin a trip is good. So in this situation, we would be looking to tap into the travel portion, travel insurance portion. Prior to that trip, we talked that it would be best practice to know the health facilities on the ground, and will they accept that insurance coverage? And if not, what alternatives do we have? We want to look at payment, how that could take place. And I share with the group that we've had something similar where we've encountered that in order to minimize the back and forth and the red tape that sometimes occurs with payment, that our agency will pay it, and then we seek for reimbursement. And the goal here is to minimize the stress on our staff member. We take on that stress and we handle all that. We want to make sure that our staff member gets a coverage and gets the attention and medical treatment that they deserve, and thereby, fulfilling our duty of care. But, proper prior planning, prevent poor performance, vetting health facilities prior to the trip, making sure that they'll accept payment. If they don't, what alternatives do we have? We're going to be tapping into that travel insurance portion. We're also going to make notification to the provider with regards to medical evacuation if the need does arrive, and get them prepared for that.
Awesome, Paul, thank you. And I really think that you took this question and you looked at it from a broader perspective. It's not just tapping into insurance policies. It's about having a plan of how do we make this as seamless as possible for the members on the ground, for yourself, who's trying to coordinate this from the US and trying to help the individual, and making sure that it is just a seamless process, not just who's paying for the expenses from the insurance policy perspective, but also what does that overall process look like, and how can you have a plan to make sure that it is a process in such an extreme circumstance. How do you make a process, the most seamless as possible? So thank you. That was great. Awesome. Well, everybody did phenomenal with their breakout sessions, and thank you so much for all of the engagement and the effort in those responses. So let's continue on to part 2. Okay, it is 1 p.m. and the hospital staff are taking steps to stabilize Emily's condition, but they are very overwhelmed. This region is not a center of medical excellence. So the facility doesn't have the ample resources to treat this complex COVID case. And Emily's situation is quickly becoming worse. The doctor recommends that Emily is evacuated as soon as possible to obtain proper care. And Rebecca receives a phone call to inform her of the situation. Rebecca then reaches out to you, and it's 9 a.m. your time. She communicates this news about Emily. She also communicates that she is completely overwhelmed with anxiety. She does not have any COVID symptoms, but she feels like she's having an anxiety attack. The other teachers, they've left the school. They now know about the situation. They've returned to their own housing units, and many of them are calling Rebecca because they feel anxious as well. So now we are going to go ahead and go into our the second portion of our breakout rooms. Group 1 is going to be asked the question, what actions do you take to ensure your teachers feel supported? Group 2, how do you handle the logistics knowing that the other teachers will need to be tested? And Group 3, what actions do you take with communicating with the school administration? Anne?
All right, are we ready? I tried to mix up the groups, so hopefully you'll all get an opportunity to work with a different colleague. So I'm going to go ahead and push you into your smaller breakouts. Again, please let me know if something goes awry, and I will solve it as quickly as I can. So off you go. Okie dokie. Welcome back, everybody. I know we had some folks that it appears that had some hard stops at one. So our group has gotten more intimate, but that does not mean that the work isn't still just as wonderful and insightful. So again, welcome back. I'm going to pass the baton back over to Jess, and we'll hear some more great insights into our discussion points after part 2.
Wonderful. Thank you, Anne. Okay, let's go ahead and just get right into it. So group 1, what actions do you take to ensure your teachers are feeling supported?
Sure. Hi, everyone. Oh, do I go ahead?
Yeah.
Yes. Yeah. Okay. So I think, at least group, tell me if I'm missing anything, but we first thought to put a pause on all programming so that our employees did not need to think about other items while they were concerned about their exposure. We talked about coordinating clinical screening, coordinating their testing, coordinating psychosocial support, the delivery of food if needed, if they're in isolation, potentially talking with Emily's or coordinating Emily's parents to come in country if needed, to be there when she comes out of the hospital. And
can I just interrupt just a second?
Sure.
I think Leslie is so passionate about that question that we jumped into question 2.
We did.
I think
I was thinking that it was showing that we were there was just like a really good handle on the situation, and the logistics were well.
Exactly,
like,
we were jumping there.
I was going with it. I was thinking.
I'll just go on my notes. Just go on my notes. Thanks, Ryan. Okay, bye.
Does it make sense to just finish question 2 out as Leslie's already?
I agreed.
Let's go ahead and let me read the question. No, let me read the question. How do you handle the logistics knowing that other teachers will need to be tested? So, Leslie, do you want to continue?
Oh, I thought that was another group. I think the logistics of it, I don't know, from our group.
Yeah, that's our group, Leslie. Yep. That's our group. Yeah.
Okay. I think one of the biggest takeaways was just being detailed in providing information for the logistics so that employees not only know where to get tested, but how they're going to get there, the transportation involved. And I'm probably not the best speaker for the group, so sorry.
No, that was great.
You are.
You did awesome.
We're doing so well.
That was perfect. No, I think you covered a lot of ground there, and I think that the there's just, there's so many things that are impacted by the situation in terms of those logistics, and testing is obviously a major part of that. But I think you covered off on a lot of those important pieces. So that was great. Thank you so much. That was awesome. And I actually think it could apply to question 1, but that's just me. Okay, so question 1, group 1, what actions do you take to ensure your teachers feel supported?
Well, despite our attempting to have a representative other than one of the facilitators of the group, we had some dissent in our population here. So I'll just summarize and ask anybody else to feel free to join in on some of the topics that we hit on. But we were talking about support, both immediate support as well as in the upcoming days. And Leslie, you did provide some great things that we had not thought about as far as logistics, but the first being communication. Communication is key, and making sure that there is a singular point of contact right there within the group who can disseminate the information so that you're delivering a unified message to everybody and they can all share in that information together. Also, at the moment, communication is very vital, but at some point in time, people tend to get overwhelmed with information. So knowing when it is that Let's check back in immediately, every hour, every 2 hours, 4 hours, 6 hours, and then after a 24-hour period or so, depending upon the feedback that you're getting from those young professionals, let's talk about, guys, how often do you want to know? Sometimes that really is anxiety provoking to hear all the time. You get overwhelmed. So on that moment, or on that topic of anxiety provoking, providing them with some tools, some immediate tools right then and there. Talk about what resources do you have to yourself? Have you downloaded a Headspace app? Can you just log on and do a 5-minute meditation? Let's work on some breathing together. Let's get you hooked up with or connected with our EAP programs. Let's make sure that you know what the plan is. So again, that prior communication, or as our colleagues pointed out, that the 6 Ps of the proper prior planning prevents poor performance. It certainly is applicable in here. Also, knowing what else it is that they're going to need to feel comforted and supported. Sometimes, and we talked about it on both sides, when you're a young professional, they probably don't have a lot of life experience to draw off of, to give themselves that comfort and assurance that everything's going to be okay, but they just want to talk to their mom, or maybe they just need to know that their parents are aware. For other kids or young professionals, they don't want to speak to their parents. They don't want them getting concerned. So kind of establishing and listening, but knowing how to get those support situations established immediately and then ongoing. George, did I touch on everything there that we talked about? Tim?
I think you did, Gabby. Thank you. Absolutely.
You did a great job, Gabby. And the other thing, obviously, with communication, especially when we're working in another culture, in another country, we want to make sure we're partnering with local leaders and community leaders, just to make sure that there's not another narrative being expressed through social media that might endanger our staff there. So making sure we're partnering well with the local community leaders.
All of that is just wonderful. Thank you, Gabby, and thank you, Tim. And I think it was a very thoughtful response. It's not just doing your part and getting something out there, sending out an email, getting it out there because that's what you have to do and you can check the box. It's really being thoughtful and understanding, the impact of whatever you communicate, just understanding what that impact is and how to provide those tools and resources. In addition to that communication. I think that's awesome. So thank you for that. Wonderful. And if we go to question 3 or group 3, so what actions do you take with communicating with the school administration?
So what our group talked about was essentially the who, what, where, when, and how that really goes into this question. We talked about having a plan in place. So for example, for those of you who don't know me, I'm Matt. I work for a company called FCM. We have a pretty robust crisis communications protocol in place. We've had that in place for many, many years. That crisis communications protocol establishes who our key stakeholders are internally, what their roles and responsibilities are, what actions they need to take in the event of a crisis, and it's easily accessible. So if a crisis is occurring, any of those key stakeholders, if they don't remember what their role is, can access that document at any time. We talked about who are key stakeholders within an organization. Somebody from HR, legal, communications, your security department, your travel department, and making sure that you're communicating with them early on, doing these types of exercises where you're bridging the gap. Because as one person noted, oftentimes HR doesn't communicate with travel every day. Legal doesn't communicate with communications all the time. So making sure that that they know what the plan is ahead of time is really going to be crucial. We talked about the what. So what are we communicating? We want to make sure that the school administration has all the tools that they need to succeed during a crisis. So making sure that they're provided with information, something that they can link them back to the CDC, giving them information about who parents can contact if they want more information. All of these are relevant during a crisis. People are going to want to know what's happening quickly, and they're going to want to know accurate information. We talked about the how. So how are we communicating with the school administration? What are the workflows in place? Are we communicating with them via email? Is there a workflow that we can put in place for during a major crisis, we can put an SMS communication in place? Also, what are the follow-ups that need to be put in place as well? So if you're communicating with the school administration, you may want to send them a polling question that says, have you received this? Are you taking the actions necessary for us to confront this crisis? And then follow up with a reminder 1 hour later or 2 hours later. So we talked about the how as well. Most importantly, this was the last thing we touched on. We talked about after action reviews. There are, two essential types of companies, the ones that are completely reactive, they don't have a plan in place. And when something does happen, you have to sit down with them and say, how could you have made this better? What protocols can we put in place to mitigate our risk in the future? But there are also companies that do have a risk management plan in place. And it's even more essential for them to do an after action review to talk about how they can become more resilient, more robust. And that's essentially what we touched on.
Great. That's all very, very, those are very great resources and tools to utilize in your organization. And I think a lot of that really does apply to this case study. So helping, right now, these students in Nigeria, they are at the school. There's parents associated with the situation who have students within the school. There's administration who also is probably feeling very much at risk. And how is this impacting their community as a whole in Nigeria? And I think a lot of those things that you touched on are actually very, very applicable in this situation to kind of understand them before you have your participants departing. Understanding what type of communication protocols are in place for this local school in Nigeria and how are you communicating with them when something does occur. Maybe it's COVID, maybe it's another scenario. Whatever it is, what does that communication look like? And especially when it does impact school students, the administration, it's impacting others because all of a sudden you're getting involved in this school in this capacity. So if, supporting them in that way with a lot of those tools that Matt, that you just walked through, I think are very important, and making sure that everybody's on the same page in terms of the policies, procedures, and protocols that are in place, and you have knowledge of that. It's very similar as if you were a school and you had students going on with a third-party provider program with another school, and so everybody being on the same page in terms of what is in place. And I think that's very, very, very important from a planning perspective. So thank you, Matt. That was very helpful. Okay. And then, so if we just, I think, well, let me go back for 1 minute just to say thank you all. Those answers were very comprehensive. Again, I think everybody did a terrific job in these breakout rooms with such thoughtful responses. So thank you for your engagement. If we were to wrap up, at least, not fully wrap up, but kind of come to a place where things are at somewhat of a stable position. At 7 o'clock, Emily was evacuated to the Center of Medical Excellence. She has now been stabilized. However, she's going to still have to remain in that hospital for a few days until her symptoms resolve. And then following that period of time, she will also need to quarantine. So she's struggling. She's going through this on her own without any family or friends nearby, but she is thankful that she's feeling better every day. So that concludes the actual simulation exercise. I really do appreciate everybody's involvement and engagement. I think that was a great session that took us through so many very important points that you all as participants brought to the table. So thank you. And now Anne is going to take us through a group debrief to talk as the larger group and just kind of talk through, how we did here with the simulation exercise.
Yeah, that's great, Jess, and I absolutely mirror. It was just great to be listening and learning as we went through this. So thank you all for your great work. So, we talked at the beginning about how do we kind of put a bow around this, and we were thinking that one great way is let's just talk as a large group about some of these things. What were the strengths of the responses that we heard? Did you all find yourself, recognizing gaps or opportunities as you kind of talked aloud with the different pieces? And then what policies and procedures were most helpful in this case and would be in future similar situations. So again, feel free to unmute yourself. You don't need to stay 1, 2, or 3. If you have thoughts on any of these, I think there's value in just sharing what your insights were. And panelists, that goes for you as well. I mean, you heard things in your breakout group. So, give the larger group the opportunity to kind of hear about what resonates with you as you think about these 3 questions.
I'll just start off and say that one of the things I find most valuable about these types of exercises are points of view. So I know that George and I, the part about being parents and having a student or a child overseas is very anxiety provoking for us. So immediately our hearts went to one direction, and it was great to hear the perspective of, not everybody really wants their parents. They might escalate the situation. So I really appreciate that. I like hearing that different perspective and how that relates back to what we do as a company to support that. Again, it goes back to let's listen, let's plan ahead of time, first of all, and know what the options are if they prefer to have that communication directly with their parents or not, or whatever their resource or know what that is ahead of time so that we can provide that to them and recognize that it may not be exactly what it is that would resonate with us. So that's one of the pieces of these exercises I find most valuable and appreciate.
Yeah, that's great, Gabby. Thank you. Really important stuff. And it's interesting, the filters we all bring to these situations and where we feel our loyalties are, but I think your point is well made. I think we need to know our subjects, know our participants, know the people that we're talking to. So absolutely, it's a great gap and opportunity, if you will, if we want to put it in a bucket. What other kinds of maybe ahas or takeaways, did you find as you listened to the responses?
Well, one thing we sort of talked was the importance of making sure before the event that people had the proper resources. So for instance, they knew, which policy they should be using and where proper medical facilities are in their location. Not waiting until they get sick to try to figure that out.
Yeah, that's great, Fred. That's really important. I think in those cases, Jess has talked about the anxiety level that's a part of this, and that sense of isolation and not having those kinds of that knowledge at your fingertips can be very, very unsettling in these situations. So I think it's important to be sure that you have those things accessible, and they're accessible in a way that they hit on the key factors that anyone would need in terms of where to go and what to do in case of an emergent situation. So that's great. And maybe go ahead. I'm sorry, Ryan.
I think the common thread I heard in all the reports back was the importance of communication. Mm-hmm. I think actually there was a group in the beginning and then a group in the end that said the same thing related to who, what, where, when, and having that all ironed out in an action plan for the various pieces of the stage that we were in of the exercise. So that's, and we all know that it's a kind of, it's not an aha moment, because I think we all in this industry know communication is important, but it consistently comes up. And yet it's probably the one thing we do end up dropping a lot during these types of scenarios. So communication before, communication during, and certainly communication after too, and having it all ironed out.
Yep, I think that's great. And one of the things I think I find too, and I push myself is, sometimes when you spend your life in this place, it becomes like second nature. And I think simulations like this cause us to step back and say, okay, just because I know these things, again, I shouldn't make assumptions that others don't. So communication, how, when, the frequency, all of those things that you've brought up as a team, I think are critical to creating a sense of calm in these situations. So really good stuff. Jess, should we move?
Yeah, and I was going to also just add, we looked at the simulation exercise, and it was pretty streamlined, or simple, I should say, when you think of the individuals involved, right? In this situation, you are the really the owner of this organization. You handle all the operations, procedures, insurance policies, risk management protocols, all of those things. So one thing that, when you take something like this back to your organization and going through this process, another layer is, as Ryan was mentioning, communication, but just really internal stakeholders. And usually it's not just one person. So how do all of those different internal stakeholders come into play? And what is their role? What is their responsibility? And that is probably even, in terms of the simulation exercise, that doesn't get into this, but it does kind of make you think and probably make you want to map that out, when you offer this type of simulation exercise for your organization.
Yeah, great point. Great point. It was funny. I was thinking lessons learned and I thought, oh, Jess is going to have this wisdom, which is great. And that is so critical in terms of those pieces. So go ahead, Jess.
Yeah, no, go ahead. I mean, we were just going to go ahead and talk through some lessons learned, which I really think, we talked through many of those lessons. I guess what we could do here is we could just even open it up for any of the participants to ask any questions regarding, really, we have all the subject matter experts on this phone who can talk about insurance, assistance, from security and a medical perspective. Are there any questions from the participants, knowing that you have all these subject matter experts on the line, that anybody would like to ask? Okay, well, I think then I guess we will go ahead and move along, but if there's anything that comes up, what's going to happen after this session is Anne will actually be following up with contact information for everybody, all the panelists and ourselves from the Allegiant team from this discussion. And so you will be able to, follow up if you have any questions for anybody. In addition, Anne did provide, oh, wait a second. We do have a question. Thank you, Jess Miller. Okay, so for medical evacuations, how difficult has government to government coordination been recently? Thank you, Jess. That's a great question. Do any of the panelists want to provide a response to this question?
Maybe I can start on this. So it's not necessarily been government to government. The evacuation that we've been coordinating are being done kind of by private companies. We do need government authorizations, right? So traditionally you need permits and clearances for the country you're going in and the country you're going to. Now with COVID, you also need clearances for every, the countries you overfly and countries where you may have a fuel stop and everything like that. So it does make things a little bit more challenging, a little bit more time than usual. But it's gotten better in some geographies, right, and not in all of them, depending on where they are in their in the epidemics. But it's been easier than, for example, Ebola, which was completely controlled by the government. So it's opened a little bit more to private companies now.
And I'll just go ahead and add that within Nigeria, we would have been dealing with, hopefully, if she was in a remote area, we could have brought her into one of the centers of excellence, one of the larger cities, as she had to be evacuated from that initial hospital, according to our scenario, into one of the other hospitals. We already know she's COVID positive, so knowing again who our resources are on the ground, knowing which companies are available or capable of moving COVID positive patients and which hospitals have been pre-identified as those centers of excellences in order to facilitate that it'll always be that red tape, but just knowing at least who your resources are and where to try and get those admissions set up and secured and make sure that they have the proper equipment to care for those patients. And then figuring out the best way to move the patient, whether it's fixed wing air ambulance, a helicopter if they're in a very remote area, or even a ground ambulance. Again, pre-identifying those providers and knowing your resources are essential. Again, inter-country, if we're staying within Nigeria, tiny bit easier, Pascaline, would you agree, than having to work, even cross the border into Nairobi for another center of excellence? But it is getting a little easier. It's still not easy.
Great, thank you. Yep, that was a great question. Great responses. Jess, I know you've been monitoring as well. Have I missed any questions?
Oops, I'm so sorry.
No.
Nope, you have not missed any questions. You've not missed any questions. We are good in our questions. What I'm going to go ahead and do is I'm going to just promote the link to the survey. If everybody could please go ahead and complete the survey, it will take literally 1 minute, and it helps us with, you know, as we do these events for the higher education and the NGO community, this really does help us to understand what's valuable to our community. So please do take the survey. It's like 3 questions, and that would be really valuable for us.
Yes, and thank you to those that have already completed it, for sure. Yeah. It's really, we do rely on the honest feedback to make sure we are getting the kinds of things out that you all need and want with your organization. So just piggyback off of Jess's encouragement.
Awesome, thank you. And with that, we'll close. So Anne, I'll go ahead and let you close the session, and thank you all so much for your participation today. So Anne, do you want to close?
Yeah, thank you so much, Jess. And again, I will just echo Jess's thanks to our wonderful partners and the time that you provided. No doubt your insight and experience and knowledge will go far. Hopefully, as participants, you are leaving with some new tools in the tool chest. We look forward to bringing you these kinds of really important and timely topic matters in the future. I will get this recording out. As Jess mentioned, I will certainly follow up with a contact list and ways to get in touch with any of us in the future. And again, we thank you. We wish you a wonderful rest of your day or evening, and we will look forward to seeing you all at another Allegiant outreach initiative. So all the best and take good care.
Thanks, everybody.
Thank you. Bye-bye.
Bye-bye.